the founder of the club, certainly a mainstay, that through all those years, it's been rock solid as a safe place to be, a place for Democrats to be. And when you look at what we've just been through over the last 4 years, I think, Democrats holding together and sticking together, deserve some feeling of vindication right now. For many of us, the inauguration felt like a way to refute a barrage of hate over the last 4 years, and instead refocus our attention on the issues that matter to us most, even in this time of pandemic. So again, thank you to the club, and I'll put in a plug for either renewing your dues or becoming a member for the first time. I mean, it's not a big economic lift, and I'll go out on a limb and say that if you're on fixed income or something and you need an opportunity to pay the modest dues, by all means contact Craig or Peter or somebody, because everyone knows a lot of people are struggling right now, temporarily at least, with loss of income or extra expenses, or having their kids or grandchildren move in with them. You have issues, contact the club. The club needs members to sustain itself. And like I said, most of my adult life, I've been a member myself. During my first few months in this office, State Senate, representing Senate District 15, which is San Jose and 5 West Valley cities, Cupertino, Campbell, Saratoga, Montecito, and Los Gatos are also in the district. It's been exciting to be here. But as Dickens said, it's been the best of times and the worst of times. And I think it's true for us as Democrats as well. At a time when we've been facing crises after crises, including constitutional crisis at the federal level, at least temporarily, with the attempted Trump coup, we've also just been facing, as I said, 4 years of grief in doses beyond what we probably should be expected to have to ever take, week after week, month after month for the last 4 years. And as a county supervisor, of course, I was at the forefront of a lot of the pushback against the Trump administration, including when I was president of the board, filing the first lawsuit against Trump to protect cities and counties from having billions of dollars taken away from them by the Trump administration for failing in Trump's eyes to round up immigrants without respect to due process or constitutional rights. And of course, we would never do that here. We've had some significant votes in the past on the Board of Supervisors where we ultimately pushed back and refused to do that kind of dirty work for ICE or the Trump administration. And of course, again, 4 years later, we're now vindicated with what I probably will always call the Biden-Harris administration, that, moving quickly, we see the administration moving quickly with executive orders and pushing an agenda, not only to reverse the damage of the Trump administration, but also to affirmatively start working on issues like immigration reform, climate protection, the climate crisis, justice reform, and so many other issues that are facing us. For me, here in the state Senate now, it's a comfortable place in terms of issues, not because the issues are easy, but because I've been working on those issues as a member of the Board of Supervisors. Again, not just going after Trump, but we on the Board of Supervisors, I think, took a lot of bold action over the last few years. And at times, we were national leaders on issues like combating the climate crisis, re-envisioning our justice system, certainly a national leader in terms of the proper response to COVID-19. I think for the most part, the public health efforts, while not perfect in any jurisdiction, have certainly received their fair share of accolades by peers and public health departments all over the country in Santa Clara County for doing it right. And of course, fighting sexual assault and gender-based violence, which I think is one of the most understated problems in politics, right next to probably mental health issues and the need for major criminal mental health reform, sexual assault and gender-based violence really puts more demand on your local government systems, on state systems, frankly, than homelessness does. And it doesn't mean we should shift from prioritizing homelessness to sexual assault, or sexual assault to mental health, or justice reform to climate. You know what it really means? For those of us old enough to remember John F. Kennedy, and I do, when he said we're going to put a person on the moon, we all thought it was the most aspirational thing we perhaps had ever heard. And for years later, that's always been held out as one of the most aspirational leadership statements and initiatives the country has ever taken on. I would venture to say that right now, with those things I just mentioned, climate, justice reform, gender-based violence, equity, COVID response, the housing crisis, the homelessness crisis, it's no embellishment or exaggeration to say we have it a little tougher than putting a person on the moon was in the 1960s. In 1969, we have it tougher. And at the same time, it's not just aspirational. Most of these issues are a matter of survival for the planet, for humanity, for democracy, in the case of justice reform. So we've got about 5 or 6 initiatives right now that are every bit as challenging as the old effort, to put a person first into space and then on the moon. I just say that for perspective, all right? And we don't have 10 years or 9 years or 8 years to get it done like NASA did. We have, especially in the case of climate, a very short period of time. And one of my top agenda items this year, in fact, on December 7th, the day I was sworn in, was to bring forward a package of climate decarbonization bills to try to point California in the right direction immediately in terms of addressing climate. In decarbonization, which means making sure that buildings and construction happens in a way that is either carbon neutral or carbon negative, reducing our carbon footprint rather than adding to it, is just one aspect of many aspects of addressing the climate crisis. But it's one where, without those bills that I just introduced today, as we go after the housing crisis and we get into housing production and we build homes and we build new state buildings and we build new schools, every time we build one of those the same old way, where we're basing that construction on fossil fuel energy, on the continued use or even exploitation of fossil fuels, we are locking into a carbon footprint for the next 60, 70, or 100 years because those buildings aren't going to go away. And that needs to be addressed now. I think it's a no-brainer. In one of my bills, SB 30 says, starting 2 years from now, we should no longer be building new state-funded buildings except in a carbon neutral manner. I mean, the alternative is to say, let's just keep doing the same old thing. And I think if you do the same old thing, then fundamentally we have to ask ourselves, all of us, everyone, including folks who are out there, and there is some opposition, is this really a crisis or not? I mean, if we were in a climate crisis that's going to essentially create the kind of emergency that we're seeing right now with the pandemic, but worse in terms of a global meltdown within 12 years, then we need to act now. If we don't believe that, then folks should just say it. And let's not do legislation like this. Let's just go back to the way we were doing things. But I think the vast majority of Americans and most Californians believe that crisis is real. And as somebody said to me yesterday over at the Medical Association, no job is a good job on a dead planet. And I get it that people want to make sure that if we're going to transition away from fossil fuels, that we're transitioning workforce in the same direction and that we're doing it properly. But we've got to We've got to do both at the same time. This is both and, not either or. So SB 30, SB 31, SB 32, those are the numbers of those bills. If you have a chance, take a look at them. Not just the first one, SB 30, with regard to new state buildings, but I think 31 talks about changing our building codes ultimately so that new construction follows a very uniform and consistent path, whether it's solar or anything else in terms of electrification, in terms of non-fossil fuels going forward, that people simply build to a uniform building code in California that gets that done. And then lastly, SB 32 asks that cities and counties, when they do their general plans, which are the basis for zoning, that they incorporate decarbonization principles, climate principles into those general plans. Again, we just have to choose one or the other. We're either going to go that direction or we're not. And I'm hoping to get enough support. We've got a couple of spreadsheets full of support now, but enough support ultimately to get these bills signed into law this year. At a minimum, as you can see, I'm taking the battle right into the state Senate, and we're gonna debate it, and we're gonna ultimately come to some conclusions about where we stand. The justice system is another area I just mentioned as an area I'm interested in. And let me just quickly say that if you get a chance, Google a new bill that I just introduced called SB 300. By the way, let me just say, my father was in the state legislature when I was a young person, and I've listened to some of my colleagues speak over the years, as we all have. I don't like to drown you in a bunch of bill numbers and a bunch of legalese because I think it's ultimately kind of boring, especially if the speech is more than about 6 or 7 minutes. And I'm going to wrap up here soon for questions and answers, but I at least have to give you the bill number in case you want to look it up. SB 300, it's called the Sentencing Reform Act of 2021. I just introduced it. It'll reform California's unjust felony murder special circumstance law and ensure that the death penalty and life without the possibility of parole cannot be imposed on those who did not themselves kill someone or were involved in a crime where no one died during the crime, or they did not intend, they did not have the requisite intent because they were not part of the individual or group activity that caused the homicide in the first place. Believe it or not, if you aren't aware, and you might not be unless you're a criminal justice expert, we right now have a law in the books that allows the district attorney to allege special circumstances, which means that someone who might otherwise be called an accomplice by most of us, who wasn't even in the building, maybe who wasn't even in the same space at all as to where the homicide occurs, gets attached under something called the felony murder rule to that homicide. And then because of the special circumstances rule, again, I won't get into the weeds on that, but because of that rule, the judge has no alternative but to choose a sentence of life without the possibility of parole or the death penalty, one or the other, no other choice, not 25 years, not 45 years, not 50 years, no possibility of parole in any situation. The average age of those who have been convicted currently under these laws is 19 years old, average. Okay, 68% of the individuals convicted under the special circumstance law thus far are Black or brown people, African Americans or Latinx, 68%. 2/3 are under the age of 25. So it's not just an average age of 19. This bill doesn't talk about freeing people, releasing people. I want to be clear on that. What this says is that from here henceforth, when someone's charged with special circumstances, because that is a thing, it exists, that the judge will have discretion to weigh those circumstances, the facts of the trial and the sentencing, and make a decision as to whether or not that person should have a path to rehabilitation or parole or a sentence that is something less than coming home in a casket at the end of their time in jail or in prison. So we think it's noble, but if there were no other reason for me to push this bill or to introduce this bill, it's those racist numbers that I just gave you. I believe, and I hope a lot of you believe, that no matter how well intentioned, when a law, a criminal justice law, is changed at some point in time by legislation that creates this kind of outcome, when we can look at statistics as after the law has been applied and they're racist, and 68% of convictions being Black and brown people is racist, okay? There's no way to get around that. We need to dismantle that law immediately and go to another model. We can adopt all of the resolutions in the world saying that we want to dismantle racism in this country. We can prop up all the commissions that we want to prop up at the state, federal, or local level. But unless we actually go after laws like this that are actually putting people away disproportionately and coming up with racist outcomes, all the commissions in the world aren't going to get the job done. So that's my pitch on that one. Okay. Sorry if I'm a little passionate about that. We have a lot of support for that.
That's what we like about you, Senator.
Thank you, Greg. Just a couple other things quickly, and then I'll wrap up. I see it's 12:30, and I really made a point for myself not to go on and on. I just want to talk about COVID-19 a little bit. I'm not going to get into all the statistics and everything. We can provide those if you, as Peter said, connect with the club or with my office, and you can do that by email to me, senator.cortese@sen.ca.gov. Please email me directly if you want specifics on vaccination, on testing, on statistics or numbers or anything else. I'm happy to do that. I think the important message I want to get across today is landlord-tenant relief is coming. I voted in favor of a bill called SB 91. But SB 91 is basically taking federal and state money and funneling it to the counties and cities immediately to provide landlord-tenant subsidies for the approximate 10% of the renter population in California. And 45% of all Californians are renters. Big number, 40 million Californians, and 45% of our people are not homeowners, or renters. And 10% of that population at a minimum are delinquent on their rent now due to COVID, not other circumstances, due to COVID impact, documented COVID impact. Those folks are going to be eligible, and if you're one of them, you're eligible for relief directly from this fund that's coming forward. Again, email me if you want details. There's going to be a lot of questions about it. I've been urging as vocally as I can the governor and the state to set up a call center, a robust call center. So folks like you, folks like the rest of my constituents can just either go to an online portal, a website, or pick up the phone and talk to a real human being and say, tell me if I qualify for this. If that doesn't happen soon enough, I strongly suggest, especially in our county, that you reach out immediately to the county itself, someone on the board of supervisors, your city council member. If you think you fall into this category, please get an application in and get in line, especially if your landlord hasn't approached you yet. The way it's supposed to work is the landlord should be approaching you, inquiring or helping you, assisting you to get that relief. Lastly, let me just say, the biggest scandal I think I've ever seen, perhaps, is what's going on with the Employment Development Department right now. It's bad as whatever you read about it. I chair the Senate Labor and Employment Committee, which will, going forward, have some jurisdiction over that problem, the problem of getting benefits out to people, whether they were federally funded benefits. I'm sorry, I have a little shadow going on here. I'm in the Capitol here next to a very bright sun, which is a good thing. But let me just say that I'm going to be in a position to try to bring some accountability to EDD and try to help clean things up. That said, we just received an audit about a week ago. I co-chaired my first committee hearing on that topic Monday. I demanded that there be an auditor embedded in the Employment Development Department daily, or an audit function. It may require more than one person to start reforming what's going on there, to start getting the claims process caught up. It's way behind. They got overwhelmed, and they did not have the checks and balances in place to avoid the fraud that you've been reading about. And it's really tragic that that's happened. It's scandalous, frankly. It's embarrassing. It needs to be cleaned up. And the state of California needs to go after anybody who defrauded that system for restitution, as far as I'm concerned. And again, needs to start getting claims out to the people who need those benefits immediately. And lastly, just to be a little bit redundant, it needs to audit that program from here on out. It's another program that doesn't have a proper call center in place. I've been pushing very, very hard, and I've received, at least a tacit support of the Senate Budget Committee to stand up a call center through the budget process that we're now already involved with. We'll see if that comes to fruition. But the good news is we have money on a number of fronts for COVID relief, including the two I just mentioned, landlord-tenant relief and employment benefits. The bad news is the state needs to do a much, much better job of implementation, and that needs to change in a hurry. So I'm going to stop there. A few minutes over my targeted time, I guess, but I have some time for questions and answers if there's any in the chat room, or if Craig, if you or somebody else wants to convey those to me.
Yeah.
And I'm going to reach over and close my blinds here a little bit. All right. While we're
right.
talking.
Peter will kind of referee that. And I do have a question, Peter, at some point, if you want to plug me in, that's fine, but let's let our members go first.
That sounds like a plan. We'll go to our guest first. So just a friendly reminder, if you have the ability, if you could type your question into the chat, that would be ideal. That way we can absolutely make sure we get to you. I see, Paul, you have your hand up already. We did have a few questions in the chat that came in before that. So we're going to go in order received. And we should be able to get to everyone, I hope. And again, if we don't get to your question, I'm sure the senator and his staff would be happy to get back to you on it, and we'll save that. If you put it in the chat, we'll have a record of it. That's the best way to do it. So this is a question from Kathleen Valdez, and I want to thank Kathleen for her donation during this meeting. Thank you very much, Kathleen, to the Century Club. California currently has only 590 geriatricians for 5.8 million in California over 65 years of age, as well as a population of those with Alzheimer's, which is expected to increase by 25% over the next 5 years. It's no coincidence that Kathleen is with the Alzheimer's Association. It is critical that we ensure that physicians have adequate training to diagnose Alzheimer's as quickly as possible and efficiently as possible. SB 48 will require primary care physicians to get at least 4 hours of training in dementia diagnosis every 2 years. Can we count on your support for this very important bill? Thank you.
Yeah, it's very likely I'll support the bill. I've been here a short time, so I haven't finished reading through every detail of every bill, but I've met with the Alzheimer's Association even prior to getting here. Very sympathetic to that legislation. Probably more importantly, I think we all have to continue to be aware that between now and the end of this decade, the senior population is going to double in the state, including our hometown. And if it doesn't double, it's going to be nearly so, big numbers. And although dementia and Alzheimer's aren't necessarily always a senior issue, they're not the disease doesn't always break clearly along those kind of lines. A predominance of the incidence does happen among our aging population, of course. And I think we can only expect that if we don't calibrate and gear up and provide that kind of medical attention that the bill calls for, and that the Alzheimer's Association is calling for, then we're asking for trouble. And it's not just on this issue with seniors, it's with senior nutrition, senior transportation, and a number of other issues that we just can't allow local governments or state government to sit on its hands or sit on our hands and assume that the money that's budgeted today to deal with these issues is going to be enough 10 years from now or even 5 years from now.
Thank you, Senator. And hope, Kathleen, you heard that sounds like he'll be supportive, or at least looking like he'll be supportive of the bill. So thank you for that. Going back to a real quick question. This is something I had to look up while you were speaking. I wonder if you're familiar with kovacs, and then what you might think of it and how we might be able to better promote it. This is it's a vaccine component of the worldwide effort around COVID, primarily looks like around equity and making sure that we have equitable access to vaccines. Maybe you could speak to equitable access to vaccines in a more general way if you're not familiar with kovacs.
Yeah, sure, Peter. So it was a big issue for me on the Board of Supervisors. In fact, equity was, when I say it, especially in terms of testing and ultimately vaccination. Remember, when I was on the Board of Supervisors, we weren't initially, not just us, but the state and the entire nation got behind the pace it needed to be on testing, mostly because the Trump administration was not providing testing kits, was not gearing up like you see the Biden administration doing and trying to get supplies out to the cities and counties. Remember, we had a president who basically said this is all going to go away by Easter of last year, and failed to provide the investment even in testing kits. So what really compounded that from an equity standpoint is as we got into late summer of last year, maybe earlier, as some of us, including myself, were really beating the drum, saying to the public health officials, you need to be transparent with the data as to where we have hotspots, what demographics we have hotspots in, what census tracts we have hotspots in, and who's getting hit the hardest. They were slow. They were afraid of medical privacy issues and slow coming out with that information. Eventually, our own county, Santa Clara County, was one of the first to start giving the zip code, at least zip code information. And we saw immediately what many of us feared is that the numbers were disproportionately high among the Latinx and African-American communities, particularly in zip codes in our county, in San Jose, like 95127, 95122, 95148, I think 95116. So Supervisor Chavez and I, which we represent most of those zip code areas, immediately asked for a $2 million augmentation of the county budget, of the COVID budget, to deal with that equity situation. And it helped activate community-based agencies, ramp up testing, got the Mexican Heritage Plaza situated as a large testing site, a lot of pop-up sites. And now with vaccination, I'm very pleased, even though I'm up here, to see that the county followed through and continues to follow through. Again, we can all be critical of whether or not they move quickly enough, but they're following through to ramp up and augment vaccination to try to match the disproportionate transmission rate, fatality rates, and other poor indicators that we're having in those populations. Biggest problem that everybody has right now, much like the slow testing kits to come out of the federal government, now we have slow vaccination. It's hard to immunize people if you don't have enough vaccination kits or vaccine to actually do it, and which is why you're seeing 65 and older only, and you're seeing challenges for state and local governments to do what would seem obvious. Why don't you just take more of the inventory and put it in those areas for, and I don't know if that's exactly what kovacs is saying, globally or elsewhere, but put that vaccine where you're having disproportionate impact. And in what I suggested, and others have suggested, and I believe Jeff Smith, the county executive in our own county, supports it, is look, as you have inventory off the top of that supply, if you think of it as a zero-sum game, of course, but you can take off the top an initial tranche, an initial supply off of the overall supply, provide that exclusively to those communities that are impacted to hit the hardest, then take the rest of the supply and just proportionately, and equitably get that out to the rest of the population. That's probably the best way to go right now. What we all need is for our wonderful new president, Joe Biden, to successfully follow through on his commitment to get 100 million vaccines out immediately and another 100 million after that as soon as possible, because that ends this discussion once and for all. But it is a real problem. It's one that is loud and clear amongst my colleagues here in the state legislature, regardless of partisanship. People up here fully recognize it. And I think, frankly, I'm a supporter of our governor, Gavin Newsom, but if he can't see the way on some of these issues, I can assure you the legislature, whether it's school opening, vaccinations, landlord-tenant relief, you will see the legislature step in this year and craft its own proposals as necessary.
Thank you for the answer. I know that's a really critical issue for so many of us, all of us, really. We're going to have a question from Kelly, a question from Jose Luis, and then Paul, I'll get to you. So just be ready. Kelly Ryan wants to know, what do you think about Assembly Bill 331, the Ethnic Studies State Curriculum Bill?
I think it's a good bill. Again, I haven't read it cover to cover, but it's important. I mean, curriculum hasn't been, the ed code hasn't been opened up and curriculum hasn't been revised in the state, I think, in any significant way for at least 4 decades. It's another, we do a lot of good things in our government, state, local, federal, whatever, over time, especially good Democrats. This is an area that should have been tackled a long time ago. I won't make excuses for people who were here before me, but it needs to be attacked. I'm on the Ed Committee. I plan on supporting that bill, but I also plan on making the argument that there are other changes to our curriculum to bring it into not only the modern world, but to bring it into a more equitable and justice-oriented context. It's not right now. It's just not, and I think most of you know that.
Great. Question from Jose Luis Pacheco, who, by the way, is president of CSEA Chapter 363 at San Jose Evergreen Community College District. He's also, I believe, an elected official in the Oak Grove School District. Welcome, Jose Luis. Thank you for being here. Senator Cortese, may you speak briefly about your bill, AB or maybe SB 438, School Employees, Classified Employees, Layoff Notice and Hearing. It is an interest to his constituency, and I'm sure to others who represent workers here.
Yeah, SB 438 it's an interesting another one of these situations that's been codified for 40 years or 50 years or whatever, really in an inequitable way. I think most of you know that school employees are not, are broken into different categories around collective bargaining, but also with regard to personnel classification. So we have certificated staff in our public schools, which are our teachers. Classified employees, typically in this state, would be represented by CSEA, the union that was just mentioned. They have a different codification for layoff notices. Essentially, teachers receive a layoff notice by March 15th, or they're not laid off. And there's a reason for that, because as you're preparing for the next school year, as you're locking into that whole process, it's always been deemed kind of the sacred date, if you will, in education for the deadline for making those kind of radical changes. And it also gives people an opportunity to get another job if unfortunately they're in a situation where the layoff isn't avoidable. They need to hurry up and get somewhere else where another school district needs them. None of that is afforded to classified workers, which are people who provide meals, including free and reduced lunches, people who are working on the facilities in these schools, people who drive buses where bus systems are still in place in our public schools. the people who aren't the teachers, but are keeping those buildings and those classrooms and those meals and those support systems flowing are typically the CSEA members who are classified employees. They do not have that protection. I think they should have that protection. I don't know why it would be extended to one group of employees and not another in our public education system. And I think that's CSEA's position.
All right, thanks very much. I'm going to go to Paul. Paul, are you, hopefully you're ready. I'm going to ask you to unmute. I think you know how this goes, so please accept the unmute. And if you want to go ahead and ask your question now, you might have stepped away because I know your video's off, but Paul Soto, hello. Okay, we can go back to, oh, no, we can go back to Paul in a second. Don't worry, we will get to you. There were a number of comments and also a question about your SB 300. If you could speak to that a little bit and maybe some of the challenges with what might present challenges with passing it.
The biggest challenge with SB 300 is, on paper at least, is that it requires a supermajority to pass it. It'll require a 2/3 vote of both houses, the Assembly and the Senate, to pass it. During the news conference a few days ago, I was asked by one of the reporters from up here in Sacramento whether or not that was a huge challenge. How much of an obstacle is this 2/3 requirement on that vote? And my response was, we have a 2/3 majority here, we Democrats, and I got to believe that my colleagues are going to be willing to dismantle a racist bill and a racist law. The bill reverses that racism, we hope, but the law on the books right now is so clearly and bluntly racist in terms of its outcomes, how it's applied. Us lawyers call that de facto discrimination against protected classes. These are protected classes of people, right? We do not discriminate on the basis of ethnicity or race in this country. From a constitutional standpoint, our Supreme Court even agrees with that, no matter how conservative it is. And yet we have a law on the books that's incarcerating Black and brown people at a clip of 68%, which also means that given the overall propensity of cases, that people who are not Black and brown are being put on lighter sentences or not being charged in the first place, perhaps, with this special circumstances rap. So I think we can get there. There are a ton of justice organizations, as you can imagine, that have come forward, and I think there'll be many more supporting the bill. We'd certainly like to have all of you, write not only the Bay Area delegation, but maybe some people that need to get an email from somebody urging them to support the bill. And again, here's our chance, to put our votes where our voices have been. Let's dismantle racism.
I apologize for the background noise. I've got neighbor's gardener next door right now. So really quick, I'll get to the question as quickly as I can so I avoid the noise. It's glaring, Robert Gupta says it's glaringly obvious that our state's lack of hospital capacity is impacting our response to COVID and other potential pandemics. Could you speak as to what could be done or what is being done to address the issue of hospital capacity in California?
We, for one thing, the private sector, hospital industry, has been essentially on a bed and service reduction program for a number of years. As a young or younger, at least, attorney, I took on a pro bono basis with people acting in community together and some other organizations, sued HCA back in the day when they were taking over the old Alexian Brothers Hospital, which is now a regional medical center on Jackson Avenue, because Alexian Brothers was by its mission providing indigent care, and they had a commitment to keeping those rooms and hospital beds open to anyone. Another equity issue. HCA did not have that commitment. HCA also owned San Jose Hospital. And it was our allegation as attorneys at the time, as public interest attorneys, that not only would HCA take over Alexian Brothers and turn it into a for-profit model that would exclude and would try to, in effect, turn hospital access into an efficiency algorithm, that they would, as part of that strategy, in time close San Jose Hospital. And what happened? So this has been going on for a long time. That story I just told you was before I became a city council member. That's how long ago it was. So this has been a trend for a long time. I think the county of Santa Clara established a good precedent with the acquisition of O'Connor and St. Louis, which were in bankruptcy, which would have been closed, which represented 450 hospital beds and 2 emergency rooms, by stepping in and saying, we have the capacity to do this on behalf of the taxpayers. We'll run these hospitals. We run VMC. We'll take it on. And it's a burden on the county, and it's going to be tough on that county budget to make all of that work over the next couple of years. And you, the taxpayers, are going to have to be supportive and patient, just like I am as a state senator now with the county of Santa Clara. But I think the state in the future, which took a hands-off attitude with regard to O'Connor and St. Louis, needs to take a very affirmative attitude in terms of saving hospital beds and emergency rooms going forward, and not letting them getting monopolized by the private sector, which ultimately ends up shutting them down if they're not profitable. That's the bottom line.
Great. Linda Hutchins-Knowles would like to know, would you be willing to push the state legislature to declare a climate emergency as you did in Santa Clara County?
Yes, absolutely. That's something we can probably do virtually overnight. I'm not sure if there's one on the books yet. The one we did in Santa Clara County was not just a climate emergency, but it was a climate restoration emergency, meaning we need to restore our carbon levels back completely, 100%. That it's not okay, to help humanity partially, that we need to fully restore the carbon equilibrium on this planet. But yes, and I think what's most important, and thank you for raising the question, we just have to prevail on getting, much like with racism, on getting our actual laws changed. The resolution's great. I'm proud that we did that in the county. I'm proud that we got VTA to do it. But the fact of the matter is, if we don't go in there and change the building code, if we don't go in there and affirmatively deal with sea level rise, for that matter, if we don't deal with plastics, if we don't deal with tailpipe emissions, if we don't build EV infrastructure, electric infrastructure, if we just, like I said, if we just go off and build another 300 and 400,000 homes over the next few years and start solving our housing crisis, but we produce homes that are dependent on fossil fuels for heating and other energy use, we're basically, I think, we're digging our graves as humanity. And as somebody said when I spoke at the United Nations a couple of years ago on this topic, don't say, let's save the planet. The planet will be fine. What we need to save is humanity. We eradicate humanity by our own self-infliction. We won't be here to see it, but nature will bring the planet back because we won't be here to pollute it anymore. And that's what we have to think about. It's just sad. It's just sad, that we're still at odds. Excuse me. We're still at odds with some of our own allies on how to go about this. And I think we all got to get on the same team as soon as possible.
I personally, and I hope I speak for a lot of us, and I truly appreciate that last comment. I've been meaning to get a shirt that says "Save the humans" and not "Save the planet." So thank you for that. The planet will be here, by the way, for another 1 billion or 2 years. So our good friend Carol Garvey, a member of our executive board, wants to know, she believes teachers must be vaccinated before children should be allowed back in school. Do you agree?
Ideally, yes. I think what's going to need to happen to get our public schools open, given the fact that we don't know how fast, how timely the vaccine is going to get here relative to school semesters, right? Is vaccine supply going to be enough by August? Is it going to be enough by July? Or is it not going to be enough until November and create yet another issue, especially if we say 100% vaccine, for teachers and students before we open? What I'd like to see, and it's something that worked way back in the days when I was a school board member doing interest-based negotiating with the teachers, particularly in Eastside Union, all 1,200 of them, we had a similar situation of uncertainty because Pete Wilson was the governor and nobody knew how many dollars would be coming on the salary schedule from the state budget. But we had to have contracts in place. We had to have layoff notices in place or not. We had to have a number of teachers' interests satisfied, including how much money they were going to get paid. And I think there's a corollary here. What we ultimately did there with teachers, and it became a model for how to deal with uncertainty, is we said, dollars received, dollars paid. You know, what we get from the state, we will hold back not a dime. It will pass it straight through to you. Now, sign the agreement and agree to come to work in the fall, right? What we need to do with vaccine, if our education community will agree, is to say something similar. Nobody wants to withhold vaccine from teachers or students and their families, but we have to have our teachers and CSEA employees, classified employees, agree to, I think, is an agreement that says, as we receive it, we will pass it through immediately and have real benchmarks and timelines on that so that they have some certainty and they know it's coming and they can start planning the next school year. That's a kind of negotiation I think we're lacking right now. And I'll be having a meeting in just a couple hours with education leaders trying to push some ideas like that. And hopefully I can be a good influence.
Excellent. So we're coming up on 1 o'clock, and I wanted to see if we could go back to Paul Soto. Are you still here? I would be happy to ask you to unmute if you have a question for the senator. I know you've been dropping some thoughts in the chat. Paul, are you there? I think you might have stepped away. Paul Soto from the Horseshoe, one more time. All right, my friend, we'll come back to you. Craig, if you would like to ask your question now, I think we've exhausted the chat questions at this point.
All right. Senator, Governor Brown was famously reluctant / unwilling, a little unclear as to which, to ban fracking. I'm wondering, what your position is on that, and in particular, I'm wondering, if there were possibly good reasons that the governor had, or that anyone might have, for going slow in that area, or can you shed any light on what that reluctance might have been about, and where do you stand on that issue?
Yeah, it's, fracking ultimately needs to go away. And I've publicly said that I support a ban on fracking. Nothing has changed my mind yet. I will tell you that the regulatory scheme that was put in place here before I got here, and I forget what year that was, made it so difficult to get permitted to do new fracking wells that I think probably, and certainly don't want to put words in the governor's mouth by any means, but I think he and some others are looking at it as, do you really need to say ban, or is it so regulated right now that it's banned on a de facto basis anyway, at least in this state? Now that's different than the nationwide discussion, right? It's encouraged in some states. So we're far ahead of some other folks. And I think the nuance that's going to be hashed out in the legislature is, and in the governor's office is, do we need to regulate it even more than it's regulated, or just flat out ban it? And that's the real question. As you know, you start tying up projects like that in CEQA analysis and environmental review, and put a few more conditions on things, and they're not likely to get a permit anytime soon. And I think that was the past strategy, and people are still a little bit wed to that. We'll see. That's what I know so far.
Okay.
Obviously, we cannot afford to risk our groundwater supply if for no other reason in this state, where places like Santa Clara are 1/3 dependent for potable water on its own groundwater. And we only have one fracking site that I know of in Santa Clara County, but it's one in a very pristine area that needs to be protected.
Great. And Craig, we have, looks like Paul is back. Paul, I'm going to unmute you if you want to ask your question. I have to request you to unmute, so you have to accept it, as you know, hopefully. Yep.
Yes. Thank you, Peter. Good afternoon, Senator Cortese. I really wanted to thank you with regard to the legislation you have in the criminal justice realm. There's just a lot of ignorance around what the abuses that prosecutors have done within the criminal justice system here in Santa Clara County. And I just want to thank you for the work that you're doing in that area, because it demonstrates that you are sensitive to the nuances that the regular average citizen is not aware of. And so with that regard, I want to thank you. Secondly, is that the Laura's Law issue is coming up again within the City Council on February 23rd. And so I'm referencing a lot of the conversation that we had a few months back when you were still supervisor with regard to Laura's Law and the implementation of it. There's a lot of ignorance around that as well. And so I'm doing what I can from a citizen's point of view to advocate for the rehabilitative piece and the resources for mental health, because there's a lot of co-occurring issues with regard to addiction, alcoholism, and mental health issues, how they kind of bounce off of each other. And when a person is from the outside looking in, does not really necessarily see an accurate depiction of what the person is really actually experiencing. And so I just want to thank you for the work and the legislation that you've done in that area. I've used your homeless study as a reference point in terms of quantifying it. And I just really appreciate the work that you're doing, and I want to support that work here in San Jose. Thank you.
Yeah, thank you, Paul. You're doing a great job, as so many of you are. You know, I was kind of given a pitch earlier at the outset for staying together in groups like the Century Club, because you have our back as legislators, our backs, I should say, because it's not just me, it's Osh Kalra, it's Evan Lowe, it's the people that need to be supported. John Laird, who has a little bit of San Jose in his district, in Santa Clara County, I should say. You know, it's your voices that really help give us the grounding to stay stick with those values, and not that we ever want to pull off of our values, but the more you can ground us by supporting us and supporting us in the community, the better. So I appreciate that very much. Laura's Law is so confused by political rhetoric in terms of how it's received by the public, in terms of people who don't know exactly what it does and doesn't do. There was one candidate that was running against me when I was running for state senate, who kept referring to it as a law that would pull people off the streets and mandate them into lockdown and keep them there. It's an outpatient law. It has nothing to do with inpatient or keeping people locked down or inside. And if it did, it would perhaps be even more troubling, because at what point does somebody who has a medical condition deserve to be incarcerated? Because they're creating some blight on the street. What we need to do is shift mental health away from the criminal platform that it's built on. When you call, if someone has an episode right outside there right now, Paul, where you are, and you see they're having a psychotic episode, and you call 911, are they going to send a paramedic or a cop? Cop. And that is the only medical condition I know of where you call 911 and say, I have somebody that's experiencing a significant mental crisis right now, or an emergency, where a cop comes instead of a paramedic or an ambulance. And we've got to change that right away. The crisis intervention is completely backwards. We're trying to train cops to be crisis intervention when we should be sending medical professionals out to do crisis intervention and take care of people. And unfortunately, it's our sons and daughters and nieces and nephews and grandchildren sooner or later that get caught up in that system. So it's not the other. It's not somebody else. Okay. Mental health issues are an epidemic in this state and in this country right now. So let's work together to turn that around. I have to go, Peter, and all of you, Paul. Thank you again, Craig. I have to get off to an outside. Somebody's waiting to pick me up right now, so I got to get out of the building here. But I appreciate the invitation today. Hopefully, I'll be back in person sometime, sharing the old buffet with all of you. For those of you that are new to this club, it normally would meet with a nice buffet table, so you get something more than just speeches with your dues. But we'll look forward to being back someday and enjoying the company of all of you in person. any way you can support any of the work we're doing up here, we appreciate it very much. Thank you. And,
Thank
and those of you who didn't get a chance to ask your question, please email me. The email is in the chat room. Thank you.
Thanks so much, Senator, for your time. We really appreciate it.
Okay, thank you. Bye-bye.
Thank you, Senator.
Craig, that is it. We did have one or two more, I think, questions in the form of answers in the chat, but we can certainly send those along to the senator and get some answers back to folks. But thanks again. I'll pass it back to you, Craig.
All right. Wanted to just make one more little pitch for please do consider either joining or renewing your membership. And the easiest way to do that is at demcenturyclub.org. And I wanted to also let you know about next month's program. I'm really excited about this. Professor Stephen Smith is going to be joining us and to give us answers to anything we ever wanted to know about the filibuster, how it evolved, where it started, where it came from, how the heck we ended up with it, and probably a little bit about what we need to do to get rid of it. So please do join us for that. Other than that, I think we're about done. I did have a couple questions for Bill and or Peter, but in the meantime, see you next month.
And we'll be posting a recording of this on our YouTube channel. We'll get it out in email. You've all signed up for email by RSVPing for this event. So have a great day, everyone.
So Peter and Bill, if you're still there.
I am here.
Okay. I was just curious. Dave was kind of fading in and out at some points, you know.
That's entirely on his end. That's entirely on his end. It's all it happened when he was on the Board of Soups. I watch all the meetings. He just sometimes if a paper is covering the microphone on your computer, or if you're too far back, like for example, can you hear me? I'm talking at the same level, talking at the same level, talking.
Yeah.
So we just have to remind speakers to either have a good mic or make sure that they're close to their screen. And whenever he shifted his notes, I think he was covering up his mic. So it was
okay.
Nothing on our end. It was entirely on his.
Okay. Okay.
Yeah,
great.
there's unfortunately nothing we can. There's no gain that we can increase. On our end to go to everybody. Although, as I said during the call, people individually can crank up their volume, but then the next person speaks and their volume's kind of loud.
Yeah, right. Whoa.
Yeah. So I think it's unavoidable.
Yeah, worth asking, but yeah, it's unfortunately not much we could do about it.
Okay. Well, thank you, Peter and Bill, as usual. Really appreciate your support.